Chest pain can be a scary and concerning symptom, and it's something that many people experience at some point in their lives. In this video, we'll follow the story of a man named Jason who experiences chest pain and learns the importance of seeking medical attention. We see a middle-aged man, Jason, sitting on a hospital bed, his face contorted in pain. He's holding his chest, and we can see that he's sweating profusely. A nurse rushes in and begins to examine him.
What's going on, sir? Can you tell me where the pain is?
My chest. It hurts so bad.
Okay, I'm going to take your vital signs, and then we'll get you an ECG.
The nurse begins to take Jason's vital signs as we hear Jason's inner monologue.
I don't know what's happening to me. I've never felt pain like this before. I just hope it's not something serious.
The nurse finishes taking Jason's vital signs and then rushes out of the room to get an ECG machine. Jason is left alone with his thoughts.
I've always been healthy. I exercise regularly, eat right, and don't smoke. How could this happen to me?
A few minutes later, the nurse returns with an ECG machine and begins to attach the electrodes to Jason's chest. The machine beeps as it records his heart's electrical activity.
Okay, Mr. Smith, the ECG is done. I'm going to show this to the doctor, and we'll get you some pain relief.
Thank you.
The nurse leaves the room, and Jason is left alone again. He closes his eyes and tries to breathe through the pain. We see a doctor, Dr. Williams, looking at the ECG that the nurse just brought him. He shakes his head as he looks at the results.
This doesn't look good.
Dr. Williams enters the room and approaches Jason's bed.
Mr. Smith, I'm Dr. Williams. I've looked at your ECG, and I'm afraid I have some bad news. You're having a heart attack.
What? How can that be?
I know this is a shock, but we need to act quickly. We're going to give you some medication to help with the pain, and then we'll transfer you to the catheterization lab for treatment.
Okay. Please, do whatever you can to help me.
The nurse administers some medication to Jason to help with the pain, and then they wheel him out of the room and down the hall to the catheterization lab.
Okay, Mr. Smith, we're going to perform a coronary angiogram to see where the blockage is in your heart.
Okay.
The doctors insert a catheter into Jason's femoral artery and guide it up to his heart. They inject a dye that shows up on an X-ray machine and can reveal any blockages in his coronary arteries.
There it is. A blockage in the left anterior descending artery.
We're going to perform a procedure called a percutaneous coronary intervention, or PCI, to open up the blocked artery.
Okay.
The doctors insert a tiny balloon through the catheter and inflate it to push the plaque and other blockages against the walls of the artery. They then insert a stent, a small metal mesh tube, to keep the artery open and prevent future blockages.
The stent is in place. Let's give him some medication to prevent blood clots and monitor him for a few hours.
We see Jason lying on the bed with a look of relief on his face. His wife, Lisa, enters the room and rushes to his side.
Oh my God, Jason. Are you okay?
I'm okay now. The doctors fixed me up.
The doctor enters the room to check on Jason's condition.
How are you feeling?
Much better. Thank you.
That's good to hear. We'll keep you here for a few more days to monitor your condition, and then we'll talk about a cardiac rehab program to help you get back on your feet.
Thank you, doctor.